Hello, and welcome to another episode of the Modern Indian Parent Podcast, the podcast that embraces modern approaches to Indian parenting. I'm Sanchita Daswani, a pediatric nutritionist.
And I'm Rinie Gupta, a pediatric sleep consultant. And every week we bring you episodes in which we are redefining Indian parenting and helping you own your modern parenting choices, even if Nani or Dadi do not agree with them. Today's episode is very special because we are welcoming our first ever guest on this podcast, Dr. Zinal Unadkat from Mumbai. She's not only a pediatrician with 25 years of experience, but also an IBCLC with 14 years of experience. And IBCLC stands for International Board Certified Lactation Consultant. And this is the highest qualification a lactation professional can achieve worldwide. And just to put it in perspective, all over India, which is a really big country with a huge population, there are only 200 lactation consultants who are IBCLCs. So you can imagine the amount of expertise that she has. She has helped thousands of mothers have a thriving breastfeeding relationship with their babies as an expert in solving feeding concerns like oral ties and low milk supply. So it's a great opportunity to have her on this podcast today. And in this episode, we're going to be discussing so much about how to feed your newborn, how to initiate a great milk supply, when to feed them, how to deal with a low milk supply, how to deal with oral restrictions, and so much more. So stay tuned for this episode if you're an expecting mother who's planning to breastfeed or you are a parent who is already breastfeeding. And here we have today Dr. Zinal. She's joining us all the way from Mumbai. Dr. Zinal, hello, how are you?
Hi, I'm excellent. How are you doing?
Doing really, really great as well. Actually, ever since I started following you on Instagram, like I saw your credentials and your work and your advice. I was telling Sanjita, we have to have Dr. Zinal on our podcast. And you won't believe it, you're actually our first guest. I want to start off this conversation by learning more about your journey. So can you tell us about your journey into pediatrics? And then how is it that you came about to super specialize in lactation?
So when I started doing my pediatric practice, I was feeling that there is something missing. And then at that time, I was working as an assistant. I'm talking of way back in 2004. I was working as an assistant with Dr. Prashant Kangu. And the sir was making the video of breast crawl in Nandurbar. And I was amazed to see, because though being a pediatrician, though I breastfed my baby, I did not know that a baby can crawl and find its way to go and latch on the breast on its own. And I was fascinated, and I'm like, okay, I have found the purpose of my life, and that is going to be breastfeeding, and I'm going to work more towards it. So many mothers in Mumbai are not getting help, and I realized that so many pediatricians are giving formula, so many pediatricians are not doing initiation, and initiation is the most important thing. And that is how I said that now I'm going to focus only on breastfeeding.
I really appreciate that you're doing this because there's so much for us as parents to learn. Like, I have twins, so when I was born, I was like, someone help me. Do I have to latch on both at the same time? Is it okay for me to, use the bottle and use formula? And as you mentioned about initiation, what are the steps that moms can take at the hospital itself to initiate breastfeeding?
So you know what? I would like to just correct your question a little bit here, that more than the hospital, I feel that, this knowledge has to be given when you're pregnant. Because if antenatally,
right.
if like suppose if I tell you that when you are pregnant and you know that as soon as I'm going to deliver my baby, the first thing is that I have to keep the baby in skin to skin and I have to give the baby my breast milk. Unfortunately, most of the parents do not have this knowledge or awareness when they are ready for delivery. Some of them do have, but some of them don't. So I feel the first step is you knowing what is coming in next and you being ready for it when the baby arrives. So when you know that as soon as the baby is going to arrive, okay, so your breast and your body is the habitat for the baby, because the baby has listened to your heartbeat, the baby recognizes you. So as soon as the baby is kept on you, skin to skin, the baby feels more welcomed, more loved, emotionally more secure. And at that point of time, the baby's all five senses are working. And when all the five senses are working, they immediately go and latch on their own. So I have seen even where probably the mother's nipples are not that well formed, or probably even if there is an oral restriction, or if there is anything, if initiation is done, the baby latches on very well. So I think for a parent in the labor room, it is important to understand that how much of a pain you are in. Even though you're going to deliver, you're going to be in pain. And even though it's going to be a task because you're not ready for it. And let me tell you, it is really overwhelming for a mother to be in a labor room where there is so many people around her and people are just telling her push, push, push. At times it becomes embarrassing and they get into too much of a fear. Preparing yourself for this before you enter into the labor room, you go through the process in a much better way.
Wow. Can you tell us more about the breast crawl? Because the breast crawl that you just described is what, got you into this path. So can you describe what the breast crawl is for us?
See, it's like imagine you're going on a holiday, right? Like I was in Singapore in Jan. So when I'm going, I was excited, right? I was excited to see the gardens of the bay. I was excited to go and see things around. Why? Because I want to explore something new. Same way, the baby has just arrived into this new world. There's a transition of the baby from the intrauterine environment into an extrauterine environment. So the baby in the first 1 hour, if you notice the eyes of the baby has a sparkle in the eyes and the baby is very excited. Oh, where am I? What am I doing? Who are my people? Okay, how are people treating me? How is this new world? So the baby uses all his five senses. So when you place a baby on the mother's abdomen, there is skin to skin. So the baby gets that. When the baby is crawling, the baby is actually following the breast. So the smell of the breast milk, one particular component is exactly the same as amniotic fluid. So that is why when the babies have amniotic fluid on them, they follow that smell. The baby is seeing the mother's nipple. Now, if you all have noticed and you all will agree with me that in pregnancy, there are a lot of nipple changes which happen, right? The nipple turns from pink to black. And a lot of time mothers ask me this question that, doctor, now my breasts don't look the same. But that color change has happened because the baby can see, because newborn babies can only see black color. They can't see pink color. All right. And the baby is listening to the mother's heartbeat. Okay. Because that's what the baby has heard all these 9 months. And the baby is trying to salivate, or the tongue of the baby comes out with the smell of the mother's milk. And that's how the baby crawls. And believe me, it's a very beautiful thing. I must have worked with more than 5,000 mothers in my life to work with breast crawl till now. We just have to support the baby. And on its own, the baby latches.
That
That
must be
is, I
so
can't believe
magical to
it.
experience.
Yeah, yeah. I had twins, and because they were born early, I actually couldn't even hold them in the beginning, and they went straight to the NICU at that
Niku.
point. It was a very different experience, but for so many parents who have this opportunity for the moms, it's really, really beautiful. And when that baby is able to latch on and just start the whole process, I think for so many moms, they start getting a bit stressed out. Oh my God, is my milk supply coming? And they're not sure if it's enough. So could you tell us a little bit on how to make sure that us as moms get a good milk supply?
What research has proven is that if the initiation is done within the first 4 hours, then the amount of milk that mother will produce is going to be very high, because you have stimulated the right chemicals to start making milk. But unfortunately, as it happened in your case, dear, that
Yeah.
probably because the babies went into a NICU and they were babies
Yeah.
were preemies, or probably sometimes mothers have some complication. So in those situations, definitely because of the other things going on, okay, the milk making hormones don't work that much. But let me tell you, having said that, that does not mean that that kind of a mother will not make milk. That kind of a mother also will make enough milk. So for making milk, what is important is frequency of feed. So it's like milk making process is a pituitary based process. So milk making hormones are pituitary hormones. So whether a mother is pregnant or whether a mother is not pregnant, if we stimulate the pituitary to do the milk making process, the breast will make milk because it works on demand and supply, demand and supply, demand and supply. So the breast needs to be frequently emptied. That means there has to be enough nipple stimulation for the milk making process to start or to continually happen. And milk making process is very dynamic. That means it works 24/7. So the more you feed, the more your body makes milk. So
Dr.
this is
Zinal,
what
Dr. Zinal, can I ask this nipple stimulation and emptying of the breast? Does the same principle apply to pumping as well? Because if you are separated from the baby, let's say, as for Sanchita's case, the babies were taken to the NICU, and if you pump, does that provide the similar kind of stimulation and give us a good basis to get a milk supply off to a good start?
see, there are some situations where you have to start using pumping. Like when, suppose if a mother has delivered baby as 26 weeks or 28 weeks, she knows it's going to be easily another 60 to 90 days before she can latch her babies, because maybe the babies are on the ventilator, or maybe the babies are in some kind of a situation where the babies are incapable of latching.
Mm-hmm.
So for a baby, it's a process to learn to coordinate the suck, swallow, breathe, suck, swallow, breathe. So that suck, swallow, breathe coordination usually comes in only after 34 weeks, between 34 to 36 weeks. So if a baby is too preemie, yes, pumping does work, because you have to stimulate the breast to keep up the supply. So I'll give you an example of one of my patients when I was working in Seven Hills Hospital. So I had this mother who delivered triplets at 26 weeks, and her babies were 600, 650, 700. That was her weight. And I counseled her on the second day of her delivery, and I told her, okay, you know what, you can pump. So this I'm talking of 2011. 2011, the awareness of pumps in Mumbai was very, very poor. Let me tell you, very poor.
Yeah.
I said, okay, we can start pumping your milk. We can start getting into it. She didn't have money. So what I used to tell my patients, and I still do, is that if you're not using a pump, give it to me. I'll give it to the needy and people who really need it. I gave her one of my pumps, which one patient had lent it to me. She started pumping, and her babies were not going to get ready for 3 months, right? She started pumping, okay, I need milk for 3 babies, 3 babies, 3 babies, because psychologically it is a lot. She started giving milk. She started producing so much of milk that till her babies were ready, she made friends with all the mothers who were outside, whose babies were in the NICU, who were not making that much milk. And majority, all the babies in the NICU were having that mother's milk.
What?
Yeah, she had so much milk. She made so much. Full day she was sitting outside and pumping. So this is an excellent example of the more you pump, the more you can make. And when her babies were ready for milk, she had 15 liters of milk stored in the freezer for all her 3 babies. 15
That's-
liters.
wow.
And you know what? I should also
That's
share
so-
with you that recently this mother came to meet me. She came with her triplets after her 10th birthday. Like, and all the 3 babies are so healthy. Believe me, it is so satisfying to see that.
Yeah, like even for me, because actually couldn't do skin to skin till about 5 days later because they were on a catheter. But I just started pumping. And the one thing I tell all my friends is figure out how to use the pump before you deliver, because I was stressing out at like 1 a.m. But then I finally figured it out, and I was pumping every 2, 3 hours, and I got more than enough milk for both my kids. And it was quite interesting to see how my body was still able to figure it out, even though I couldn't hold them yet for the first 5 days.
You very correctly said that, right? You need to know the pumps. Because see, buying a pump is like buying a phone, mobile phone. You go to the market and you're confused because there are hundreds of brands. Same way, pumps, okay, the motors are different. The capacity of every pump is different. And the flange sizes are different. So what flange size is going to fit into what nipple also decides on how much milk you are going to be pumping. So I have had mothers who have damaged their nipples very badly because of not using the right flange size. And if your flange size is not right, you are not going to be able to pump out that much milk from your breast. And then psychologically, you will think that I don't have milk. I believe that even if you are going to be pumping for any reason, like I have mothers who have celebrity moms who have to go for shoots on 9th day, 10th day of the delivery because it's an ongoing shoot and they can't not go. So then I only tell them one thing, that try to give the baby whatever skin to skin you can, and give the baby that touch you can, so that your body continues to get the milk making hormones. Because if you are going to be exclusively pumping, and if you are going to be separated from your baby, your supply is going to drop. Right? So even if your baby is in NICU, you need to go and see the baby. You need to go and touch the baby. You need to go and cuddle up the baby.
Yeah.
Yeah.
And, I think for a lot of parents, it's this whole low milk supply, because when you're breastfeeding, you get very confused. Is it enough? So how do we know as parents whether they're having a low milk supply? Should we pump and check the amount, the quantity?
So, I had a very beautiful international talk which I gave on low milk supply last year, I think. So in this, I tell all parents is that 95% of the times, whenever a parent tells me that I have low milk supply, it is a perceived low milk supply. What I mean by that is that the mother feels that like, I don't have milk, because maybe the breasts are not getting fuller, as people tell her, or when she's pumping, she's not seeing anything, or at of times they feel that after I fed my baby is crying. And they perceive that every time a baby is crying, the baby is crying because the baby is still hungry, but which is not true. Okay. And I was talking about stress. Stress is the only thing which kills the milk making hormones. And a majority of the times, the reason a mother does not make milk is stress. Only 5% of the times the low milk supply is real. It could be because of mother has maybe breast hypoplasia, maybe she has small breast, or she's had a breast surgery. Now, for a mother to understand that is my milk supply fine or is my milk supply low, there are certain check marks. I have created a rule of 8. That means after day 8, if the baby is passing minimum 8 times urine in 24 hours, if the baby is taking 8 feeds in 24 hours, however those 8 feeds are spaced, if your baby started to regain the birth weight, if the potty color of the baby has turned yellow, and the baby has a nice, calm look on the baby's face, that means you're doing a great job. So this is about the first few days. When first few days, you're always confused that am I doing good or am I not doing good? The body has its way of calibrating. Now, when we talk of milk supply, okay, there are little physiology which goes in. Okay, so there is lactogenesis stage 1, stage 2, stage 3. So stage 2 starts, first stage is in pregnancy. Stage 2 starts when the baby comes in, when the body just starts to make milk, which is colostrum. So colostrum is very minimum in quantity, not visible to naked eyes, and it's like few drops of yellow liquid. So at that point of time, if you as a mother know it, that okay, colostrum is not going to be a lot in quantity, colostrum is not going to be like flowing, and it's okay if I cannot see milk, but this is there in my breast. So having this knowledge that colostrum is there for the first 48 to 72 hours, which gets converted into mature milk, which is your lactogenesis 3, after 48 to 72 hours. So after 48 to 72 hours, suddenly the breast becomes full, and a lot of times mother gets engorged. At that, they also get that mastitis and that fullness feeling, and the breast become very hard. So that is the time when your body hormones are kicking off to make a lot of milk. Then you need to keep feeding the baby to remove that. If you don't do that, then there is something called as negative inhibiting factor, FIL, which comes in, which says, okay, दूध की जरूरत नहीं है, दूध बनाना बंद कर दो, दूध की जरूरत नहीं है, दूध बनाना बंद कर दो. And if you are not frequently feeding on the second day, third day, fourth day, this is what happens, and the body reduces making milk, which a lot of times, it just goes unnoticed. Now, if you have been frequently feeding at that time, then the body calibrates on its own anywhere between 7 to 14 days. So this is like a calibration, like an auto mode that, okay, this is the milk we need, this is what we will make. So if that calibration doesn't go right, then again the milk making process reduces.
I think as moms, we need to trust the process. Before we move to the next topic, I have to ask you about this because I feel like I got a lot of milk because I ate certain things, right? So I got this thing, Sata Varex. I used that in my oats. I had a lot of jeera. I had a lot of ghee. My mother-in-law had made me something with some powders in it. So I was just eating all of these things. Now, I want to know from you and your expert opinion, do all these supplements and extra stuff in the food, do they actually help with milk supply?
So first thing is milk making process is here. If I decide today that I want to run a marathon, I can do it. Whenever there is a will, there is a way. So if a mother decides that she wants to make enough milk for her baby, she can make it. If, in Mumbai, there are a lot of people who come on the signals. I mean, I don't know how many of if you all have ever come to Mumbai and seen.
Yeah,
There is a bai who will come asking for money, like begging money.
Yeah.
She'll have a small baby which she's tied over in a sari over here. And the baby is continuously latching, right? That mother does not have shatavari. That mother does not have any doctor. She must be just eating basic dal, chawal, roti,
Basic.
sabzi type of food. But she makes milk. How? Because she knows that this is the only milk she has to feed the baby. When we as parents understand this, that milk making process is a hormone driven process which your body is already knowing how to make milk. And if you know that I have no option, I will make. The problem is we get carried away. Can I pump? Can I take tablets? Can I eat this? And then we confuse ourselves more. I always tell this to mothers that I'm conservative. I believe in going back to the basics, that breastfeeding does not require any gadgets. Breastfeeding only requires you, your baby, and maybe a dupatta to cover you. You don't need anything more than that. Now, if at all your body is not well hydrated, or maybe my body does not have nutrition, then my milk supply will fall. So what you did, Sanchita, was excellent, because when you are eating these spices, now in Indian culture, Indian food, The spices hold a real good value. Whichever mummies make laddus, they make raab, they make shira. All these do have some properties to kind of regulate your hormones. And that is why your body's stress reduces, your bone pain, your back pain reduces, your body starts making more milk and you start feeling more energetic. So I believe in using Indian spices a lot because I am very proud to say that this is something which in our culture, which is excellent for making milk.
I mean, in Singapore, of course, the doctors don't have that much awareness about all the Indian spices. But the only like supplement that I was given were these fenugreek tablets, basically methi tablets, and apparently that is supposed to boost the milk production. How do you feel about fenugreek tablets?
So fenugreek is excellent galactagogue. It is proven to be. So in India, we get methi seeds. So we ask mothers to either have it as a laddu or soak it and have it. So it's like, if you don't have methi, then you take the capsule. If you have raw methi, if it's available to you, then have the methi. So all these shatavari, whether it's a moringa, whether you say methi, or all these are basically our, uh, uh, Ayurvedic treasures, okay, which are there going on for years. Like in Gujarat, when I went, so I am also associated with UNICEF, where I do a lot of grassroots level training. So I go to Anganwadi workers at village levels and train people for breastfeeding. So I have done this like in Orissa, Chhattisgarh, Maharashtra, Gujarat, a lot of states. So in Gujarat, they use moringa because they don't have money to buy anything. They have moringa trees. Moringa is drumsticks.
Yeah.
Right?
Okay.
There I saw that every mother who's breastfeeding, the mother-in-law or the relative will go pluck moringa patta and will make a chutney out of it, or she will add it she will garnish her food like how we garnish it with coriander, and that mother starts making amazing milk. So all these things do work. At times, I feel that it also psychologically works on the mother that, okay, because I'm having this, I am going to make more milk. So that could be a possibility. But I think if there is no harm in having it, if it is not harming your body, if it is only replenishing your body and giving you nourishment, works. Please take whatever works for you.
Thank you so much for clarifying that, because there's so much marketing out there where there is like the milk tea and then there are all these lactation cookies available in the market now. So you get confused and I think you fall into the marketing trap. But I like that you're saying that you don't need to spend a ton of money in investing in all of these things. It's just go back to the basics, look back in your spice cupboard, and pretty much anything that you need to supplement and help your milk supply is probably already there. So thank you, Dr. Zinal. That actually gives us a lot of clarification in terms of how to initiate breastfeeding, how to get a good milk supply out of it, and whether or not we need supplements. So let's say now there is a mom who has given birth, the breastfeeding relationship is more or less established. But the most other common question that moms face is that, okay, how often do I feed my baby? Because when you go online and Google it, it's going to be like, okay, every 3 hours. Or somebody's telling you, no, you just have to feed on demand. Or anytime baby cries, you should be feeding. So can you advise us that how often should we feed babies during the day? Should it be on demand or should it be roughly after fixed intervals?
So it's like, I'll ask you a question. Do you make chapatis?
Yeah.
So do you make round chapatis from first day? None of us do.
Definitely map of
No.
Africa right here till
Yeah.
date.
Yeah. So imagine if I tell you that the baby will become an expert on first day and the baby will start making round chapatis from first day. That's not going to happen, right? Same way, when the baby is breastfeeding, the baby also needs some hand holding. So that hand holding is that, okay, we need to do proactive feeding. So what I tell most of the parents is that first 7 days we need proactive feeding. That means you need to make the baby come to the breast again and again so that the baby gets a practice and the baby kinds of learns how to do it. Okay. That means you can wake up the baby, put the baby to breast every 3 hours. So you can do like 20 minutes this side, 20 minutes this side, because you're stimulating both your breasts enough so that both your breasts learn how to make milk. But after the regulation has happened, once the baby has learned to latch, that means once you know how to make round rotis, you can make rotis kahin bhi. Kisi pe bhi ghar pe chale gaye, koi bhi pata de diya, koi bhi belan de diya, we can do it. Why? Because we know how to do it. Then once the baby has learned, once your breastfeeding has got nicely established, which happens anywhere between 7 to 14 days, then you can start going on to on-demand breastfeeding. That means only follow when the baby demands. So if the baby is sleeping, you let the baby sleep because the baby will also go into cluster sleep and cluster feed. So at times what happens, the baby might take a feed, they will keep the baby down, the baby will do potty, the baby will be hungry again. So are you going to tell the baby 3 घंटा नहीं हुआ है वो तो बुखार है? No, you are going to give the baby. So that time also at times a lot of mothers tell me, doctor, I just breastfed. He's again asking, what do I do? I'm like, give. So then there is no rule. The rule is the baby.
Yeah.
Let the baby form its own rules.
Got it. But Dr. Tina, the on-demand model is also something that is very popular, and research also shows that it's good for the baby. But what do you do in scenarios where it's not just after one feed the baby is asking for milk immediately, but this is happening throughout the day? So I work with moms, and they have told me that like my baby just never leaves the breast. I'm feeding for 40 minutes at a time, every 2 hours. So is that something that we need to fix?
A lot of times when babies are wanting to latch for longer time, or they are wanting to be more closer to the mother. So I feel we need to differentiate that first, that is it hunger or is it that the baby needs to be along with the mother to co-regulate. So what I mean by co-regulation is like we all have an autonomic nervous system, right? So babies, when they are new to this world, they cannot self-regulate. This is like a huge complaint I get from almost every mother. That जैसे ही नीचे रखा, baby starts crying. The moment I lift the baby up, the baby is calmer. Okay. Now this is because the baby needs that physical touch. So if the baby is wanting to stay latched onto the breast, is the baby wanting to stay because the baby wants to co-regulate, or whether the baby is still hungry? We need to differentiate that first. Now, if it is hunger, that means we need to check the other parameters. That is the baby gaining weight? Is the baby passing enough urine? Is the baby passing potty? So here there could be a possibility that if a baby is taking long feeds, that the supply of the mother is dwindling, or that this baby is not transferring enough milk. That means we lactation professionals come into the picture over here to check the latch. Is the latch fine? Is the baby actually transferring milk? So this is how we need to analyze what is going wrong. What is the thing which is missing in the puzzle? Right.
Charging. Yeah.
Dr. Zina, so one of the things that I picked up from what you mentioned is the milk transference, and how transferring the milk is very important to get a good milk supply, to make sure the baby is happy and getting enough in the day. What are some problems that can occur in the latch that can lead to a poor milk transference?
So see, it's like for a complete latch to happen, okay, like this is, for example, this is the baby's mouth and this is the breast. The nipple needs to reach the junction of the hard and the soft palate, and the baby seals on the breast. Now, if this seal is not complete, when the baby sucks, the negative suction which needs to form at the back of the mouth for the baby to transfer milk does not happen. So the milk transfer is actually suction driven. That means if I do this, if there is suction, only then the milk, because of the pressure gradient, will move from the breast into the baby's mouth. Now, if the seal is incomplete, then actually the baby is only sucking at the breast, but the baby is not transferring the breast. At that point of time, we do have mothers who come to us with probably a lot of nipple pain. The mother is having blocked duct. The mother is having again mastitis, or the baby is not gaining weight. The baby is having reflux. The baby is having a lot of gas, and the baby is cranky baby who's wanting more and more milk even after feeding. Like I have this mother who came in to me, doctor, I fed him for 1 hour and he's still hungry. He still wants formula. So the mother doesn't know that actually my baby is not transferring milk. So if you think that your baby is not drinking, please take help of a lactation professional so you know that your baby is transferring milk. But for you as a parent to analyze the latch, I will just explain you one simple thing. One, when the baby is drinking, observe the baby swallow. We focus on the suck. We don't focus on the swallow. So when you see the swallow, like if I'm drinking water, if my mouth is full, only then I will swallow. So if my mouth is not full, I can't swallow. If I'm chewing a gum, okay, you will see my jaw movement, but I'm not drinking. So that is the difference. So if the baby is only doing, the baby is not drinking. But if the baby is doing swallowing, that means the baby is actually, so you can actually hear the swallows if you notice it well. Now, why doesn't the baby transfer? Sometimes it is that baby has a restriction, which could be either a tongue tie or a lip tie or a buccal tie, or probably the baby's chin is quite protruded. It could be like which is a quite recessed jaw, because of which the tongue is more behind. It could be that the baby has a very high arched palate. At times it could be inverted nipples, recessed nipples. It could be probably very, very flat nipples, or it could be the baby is having some muscular issues. So there could be multiple reasons why the baby is not transferring milk, and that is why you need to get it analyzed and assessed. Now, if it is a tie, which is a very common thing, what I see, so whenever there is a tie, the baby is not able to cup the tongue. And because the baby does not cup the tongue ideally needs to go and rest at the palate. Then, now if the tongue does not go and rest on the palate, because there is a tie, the tongue will sit on the floor of the mouth.
Okay.
And these babies will keep their mouth open majority of the times. That is why they are more gassy. These babies are not cupping the tongue, so they are not drinking milk. These babies will have a lot of reflux because there is a lot of facial tightness. The baby keeps spitting up milk. The baby has a lot of torticollis and the baby keeps arching and the baby has preference to one side. And these babies are very uncomfortable and they don't settle down. So they are looking very all the time uncomfortable. And because they have spit up, unfortunately, I'm seeing a lot of time pediatricians put these babies on 100 medications to stop the reflux, which is not advisable. They ask them to give some cereals which are thickened, which is not advisable. They ask them to keep too propped up and elevated, which is again not advisable. So it is not good for the baby to be very, very propped up. It is also not good for the baby to, you trying and experimenting by giving so many antacids and reflux and gas medications. So ideally, identifying why the reflux is happening is very important. Identifying why the gas is happening is very important. So a lot of things could be related to the ties.
Do spot this.
Oh, sorry.
Let's say you do spot this issue that, okay, the baby is latching but not transferring milk. Who would you go to? Like, would you go to a pediatrician about it, or would you go to a lactation consultant to get a diagnosis or of an oral tie?
If you ask me, I would say lactation professional first because pediatricians, a majority of the times, are very busy in their practice. They don't assess the latch. And probably in a medical school, unfortunately, we are not taught all about it. I would personally feel that if at all it is a issue of baby not transferring, or you feel that the latch is not adequate, then going to a lactation professional helps more because they would give you that much of time which you need, which a pediatrician will not.
True, true. And I think it's very rare to go to a pediatrician and get a latch assessment. Like, you never go breastfeed at a pediatrician's office for the pediatrician to analyze it.
A lot of
Because
times
if
it
you,
is a male pediatrician, she's feeling awkward. There are a lot of
true.
things going on there.
Absolutely, because if the baby is not gaining enough weight, maybe if you go to a pediatrician's office, probably the first solution you will get is start supplementing with formula. But if you go to a lactation consultant, they're going to dig so much deeper into your breastfeeding relationship. Okay, what's going on over there? Let's assess and fix that. Okay. So let's say we do go to an IBCLC or a lactation professional in our area who's specializing in oral ties, and they do say that, like, okay, yeah, your child has an oral tie. Can you tell us, like, what are the various treatment options available for an oral tie, and how do you kind of choose which treatment option you should go for your child?
So it actually depends from baby to baby. So you
Mhm.
treat a symptom and not an anatomy. Like I had recently a baby who had a severe tongue tie, which I could see very evidently, but the baby was latching well, the baby was drinking well, the baby was gaining weight well. The mother had no complaints. She came. So a lot of times there is a tight tie, but the tongue learns how to perform its function. So if the tongue is performing its function, I will not do anything about it. I will just
Mhm.
let the mother baby diet be happy amongst themselves. I will tell them that if there is any problem, come back. So I will treat a symptom. I will not treat an anatomy. If there are severe symptoms which is affecting the baby and the mother, then only I'm going to intervene, not otherwise. Second, if I feel that maybe there are one or two symptoms, then the only thing which I would advise is doing some tongue exercises. So it's like
Okay.
you kind of training the tongue to cup, training the tongue to elevate. Okay, then just some exercises help. If I feel that the problems are a lot, then something called CST helps, which is called craniosacral therapy. Craniosacral therapy is not really that recognized in India because there are very few CST therapists, but it's kind of an aligning the body to the center and aligning the autonomic nervous system of the body and aligning the babies between the cranium and the sacrum. So that can help. And if it is anatomically a very tight tie, which is causing a lot of function and symptoms in the mother-baby diet, then a probable release by the appropriate doctor is required who has the right knowledge, could be a pediatric dentist or a pediatric surgeon or a person who has been trained to do this. Uh, there are two options. One is doing a scissor release and second is doing a laser release. So either you could choose depending on which provider is available in your city.
I just wanted to say that's why I really appreciate what you do, because honestly, just listening to you, I do feel a bit at ease that for moms, if there is an issue, there is always, it's okay to seek help. Sometimes as parents, we're like, no, we'll figure it out. So I really appreciate, the amount of parents you've helped and the moms, because it just makes our life so much easier and more at ease to know that we have that support and there is a way to fix things.
Yeah. Oh my God. I think I've learned so much about this. Like I feel like these are fields where you're like you may have breastfed your baby, but only when you talk to a lactation consultant, you're just like, oh my
Yeah.
God, there's so much I did not know that can happen. And I think this episode will be so great, not just for moms who are breastfeeding their babies right now, but also for expecting moms who are planning to breastfeed. So thank you so much, Dr. Zinal, for sharing everything with us.
Yeah. Okay.
Okay. All right. So, everybody, the next segment is a myth or fact rapid fire. It'll be like the coffee with current style rapid fire, but just with the myth or fact style. So, let's hear from Dr. Zinal whether the following statements are myths or facts. First one, drinking milk helps to improve your milk supply.
Myth.
Okay. Breastfeeding can reduce the risk of breast and ovarian cancer.
Fact.
Breastfeeding helps you to lose weight.
Fact.
Breast milk can have different colors.
Fact.
If you breastfeed with your hair wet, then the baby will catch a cold.
Myth.
You can't overfeed a baby.
Myth.
Women with small breasts will have a low milk supply.
Myth.
If we start going into the explanations of every single one of them, we will have one
Yeah,
more
we-
episode ready right
Episode.
here. Like this episode will need a sequel
I
to
know.
it.
Thank you, Dr. Zinal, for taking the time and really providing us with so much knowledge that I think also I wish I had some of it before, but I'm so happy that everyone listening here is going to have such a great experience with this podcast. Thank you for joining us.
Welcome. The pleasure is mutual. I really enjoyed talking to you too.